speaker for today, to Don Cross. So I'll start off by introducing Dr. Weininger. Take it away.
Okay, Dr. Walker, thanks a lot and great kind words. And I'm even more proud to introduce Dr. Don Cross. He is a chiropractor that's also a certified compliance officer, one of the very few people that have that designation. And he's a chiropractor. He's leadership in the profession, full-time professor at Palmer, Florida. He's a certified instructor for the Council on Chiropractic Guidelines. He's a board-certified disability analyst, and he wrote and put together the Obamacare Compliance Manuals, OCCM, which is we'll be talking about that along the way. He's the second vice president of COXA. He's a past Florida Chiropractic Association director, and he's one of the people that knows the profession and knows how the profession is, and more importantly, he has strong ideas about where the profession should be going from our conversation, being responsible and successful in the incredibly changing times in which we all find ourselves practicing. So, Dr. Cross, I'm gonna give it to you and take it away.
Thank you very much. Today we're going to focus on 6 primary things that every practice needs to have to be able to be compliant. We're going to focus on a lot of information today, but we're going to try to narrow it down or refine it down to 6 basic things that each practice has to have. And I want to make sure everybody realizes that it's not just us chiros that are dealing with this, that all the providers in the country are having to deal with this compliance program and all the changes and all the audits. It's just not, something that's being focused on us, but every provider in the country, from the largest hospital all the way down to the mom and pop practices, we're all dealing with this. And it can be very overwhelming, and so we're going to try to really wind it down to like just 6 main things. We've got a lot of information to cover, so we're going to go through this pretty quick. But I've changed my manner, the way I present these slides, so that if you're taking notes, I'm just going to put up a slide. I'm not going to do any fancy transitions or anything like that, so that when the slide comes up, you're going to have access. Well, now what's going on with my computer? There we go. So that everything is on the page at one time, so it makes it easier for taking notes. So today we're going to focus on policies and procedures that are written and designed to protect your practice. Now, there's a lot of things that goes with this protection. It's not just for the audits. That is a big part of this and what's pushing a lot of doctors to switch to this. But these policies and procedures are going to protect you from fraud, from theft, and definitely from security breaches. And one of the things that's getting to be such a problem here in the U.S., the frivolous lawsuits. So having all of these policies and procedures in place give you some protection, give your attorney in a situation something to work with. And so this is all going to be focused on protecting your practice. It's not just the IT. When we start talking about HIPAA and high-tech, the OIG's compliance program and all of that, most people just kind of want to focus on the information security angle of that. But it's a lot more than that. It's a whole series of different things that goes into not only information security, but your personnel and how you hire and vet them, the operational security, more than just your passwords. We're talking about the security codes on the building. We're talking about the keys to your office, things like that. Now, disaster recovery is something else that most people don't realize, but the new laws require that we have backups so that if there's any type of a disaster, in Florida, of course, it would be a hurricane, but whatever might strike your office, we're now mandated to have disaster recovery policies and procedures. The contingency planning for what happens if the power goes out, or your computer dies, or your server dies, things like that. All of these are all part of the new environment that we all have to practice in today. So the number one point, the first point we're going to talk about is how these specific policies and procedures are to be written, and they have to be written and for each of these following areas. Now, all of these areas are going to be hitting the points from either high-tech for the Ombudsman's report or for HIPAA, for the compliance program. All of these different things now are basically required for every practice, and so we're going to hit those real quickly, but just to make sure everybody understands that at this point, you're mandated to have a compliance officer appointed, and all the duties and responsibilities that it goes with that position needs to be in a written policy and procedure. You have to have policies then that direct your compliance officer to do reviews on an annual basis and how to document that. One of the things we had seminars or webinars on before was on all of the logs that are now required. So there's a whole set of logs that are brand new that we have to do now because of HIPAA and high tech.
Dr. Cross, I've got to interrupt with a question that I'm getting as you're saying this. So you said a moment ago that we need to be focused on having a plan for disaster recovery, which you're in Florida, you've got hurricanes. I'm in Georgia, we've got tornadoes up north. They get ice and floods and whatnot. But so basically, you need to have. It's not just knowing what to do, but you need to have it documented of what you're going to do and be reviewing that annually and have someone's signature on that document saying that you reviewed that annually. Is that correct?
Correct. That's
and
very true.
And so if you haven't done that, then even if you have a thing written out of what you did, but it hasn't been updated on an annual basis and they audit you, is that a problem?
Yes. NIST, the National Institutes of Standards and of Technology, has basically provided all of the regulations now and the guidance that we need to do on our backups. How is things stored to the cloud? How are you backing up your data every day? So if your server dies, you're mandated now to have a backup off-site. So if there's something, God forbid, your office burns down, your data is not lost. In the past, we didn't have anything telling us we had to do that. Now there are things out there that says because we're holding this protected health information, and since we're in holding that and we are responsible for that, we're responsible for making sure we have a backup off-site so that if something does happen to our buildings, we can still be able to pull that information up. And we're supposed to periodically double check so that if there is a problem that our backups can be reintegrated with their software and we can then provide the patients with their health information that they needed. So it's gotten a lot more complicated as the different federal organizations and agencies have learned what was in Obamacare and what all the different regulations that had to be developed out of that law. We're seeing things like NIST putting out these guidelines that this is how they interpret the law to say we need to do things. And so we could do a whole webinar just on NIST and all of the requirements, but we haven't got time to go in that today. But just remember, you are responsible for having some of that information backed up securely, etc. Compliance training, you've got to document it. You've got to have lines of communication set up within your practice so that if there's a problem, everybody knows who to report it to. We have to do our self-audits, of course, be able to develop corrective action plans with any problems that we might find. Record retention. This has gotten to be so complicated that I would definitely suggest that we might want to do a webinar some afternoon just on record retention.
I'm noting it right now.
So different. I mean, right now, just to give you an example, patients' financial data, depending on which federal law you're looking at, some requires things to be kept for 7 years, some things 10 years. Audit records, if you have a federal payer audit, how long do you have to keep those records? Some are for 5, some are for 7. Medicaid data, how long do you have to keep that by the federal law? That's 5 years. Radiology data, so your x-ray reports, your x-rays, how long do you have to keep those? 10 years now by federal law. So there's, a lot of things have changed in the last, say, 5 years with how long we can maintain our records. Thank goodness it's so much cheaper to do now with cloud storage, but it has gotten really, really complicated. And so you really need to have good, solid, written policies and procedures on how often you destroy your records and how you actually do destroy those. Kickbacks and inducements. We have to make sure we're following those. And again, that's something we could spend a whole webinar on and just talking about kickbacks and inducements. But in the past, we really didn't have to worry about it. But now, because of the atmosphere in Washington, when one agency gets involved, they're mandated now by the executive order that all the agencies comply and work together. So, if something starts out as a simple Medicare audit, it can spread like wildfire into other agencies and all kinds of problems. So you need to have those policies and procedures in place stating that you will not do kickbacks and you won't offer inducements to your patients. Disciplinary guidelines, something most practices don't have in writing, but unfortunately now we need to make sure we have policies and procedures for a tiered disciplinary system in place in our offices. So if there is a breach, we can show that because of the breach, this is what's going to happen, this is the disciplinary action that will occur. That's what they want to see when they come in after a breach and see that everything was handled, that there was disciplinary, there was a corrective action plan designed, etc. This is something that they want when they walk in the door. When I say they, I mean the feds. Documentation, an ongoing problem still for chiropractors. We still have one of the worst records in Washington for documentation. During the summit meeting we were talking about earlier, there was a presentation made that the last CERT review in the Northeast, there was a failure rate of 93%. 93% of the claims that they looked at, the documentation did not support medical necessity. We still got to clean up our act, guys. There's a lot more to documentation we have to do. Guidelines for each payer type. Different types of payers require different things that we keep on file, etc. You got to make sure we have policies and procedures written for that. And then that government reporting. That's if you have a breach, you have to have policies and procedures on how those things are reported. We're going to talk more about those in a little bit. So what are the benefits of having written policies and procedures? I mean, actually, when you boil it all down, it should improve your practice. It should really make it more efficient and actually should improve your bottom line. So there are lots of reasons for having those written policies and procedures beyond just because the feds say we have to. You want to make sure that they're helping to identify undercoding. Now, chiropractors have this notorious reputation for downcoding. We do an examination that's really good. We document it, and we still end up coding for the lowest level because we don't want to raise a red flag. Well, that's wrong. The feds see undercoding in the same light as upcoding like the MDs do. The MDs have a reputation for upcoding, and we have just the opposite. But from CMS's viewpoint, both of those are fraud, and they want to make sure that we're coding to the most accurate level possible. So what do you do with that? Well, that brings up your reimbursement. That helps the bottom line. So there's really, really a lot of push to make sure that you're coding correctly. And with good policies and procedures in place, it reduces the number of claims, facilitates your submission so you get your payment sooner. You want to make sure that all of your employees know the rules and what's expected of them. So your policy and procedures covers all of that. As I just mentioned earlier about a CERT report that was just done, they're looking at our documentation harder and harder. You've got to make sure you have policies that state that you're going to do the documentation correctly. Staff education, something that we've never had to worry about in the past. We're now mandated to educate our staff on HIPAA and high-tech and some of the OIG things. So that's something else you have to have in writing in your policies and procedures. So all this utilization of these policies and procedures really helps reduce your liability. It reduces innocent billing mistakes, reduces the possibility of fraud and abuse. And when you have these in place and the government asks if you do, and you can say, yes, here's a copy, a lot of times we're seeing that the government will not go in and audit you if you can show that you're doing what they want. If you have nothing in place, well, that just puts a big bullseye right on the practice. So, all of your weaknesses with internal policies, you really need to tighten things up. And with doing that, it really helps prevent criminal or unethical conduct in your practice. The government basically said they want us to create an environment in our office that encourages the employees to report concerns or problems. Even if it's just an office with the manager, the doctor, and let's say one CA, you still have to have whistleblower protections built into your policies and procedures. It's now mandated. So, things that we would never even think about in our offices, we have to have that whistleblower protection there for them. It's just part of the basic law.
Don, I don't think a lot of people realize how profound that is, because I've seen practices, like very old school practices, where the doctors did things the way that he thought they should be done, and I've had staff people that have told me when I've been in some practices that they don't think that it's right. And what you're telling me is that that as part of policy and procedure, you need to be documenting that you're telling staff that they can report something to the government, and you can't do anything about it if they do.
Right. And beyond that, the whole attitude and the way the law has changed as well. In the past, if there was fraud going on in the office, the feds would come in, and most of the time they would just charge the doctor with the fraud. Well, the way things have changed now, when they walk in, they're charging not only just the doctor, but they're charging the office manager if they were aware of it. They're charging the CAs if they were aware of it. You know, they're basically anybody that knew or suspected that something was wrong, they're being charged as well. So it's not just the doctor that's being handcuffed and marched out the front door. It's sometimes every staff member in the office is being handcuffed and marched out the door.
Well, ultimately,
so this
I
is
think
a major change.
and that's my thing. It really is a big cultural change in a lot of offices. But the bottom line ultimately should be a good thing, because if it creates a situation where everyone's doing what everybody should be doing in the first place, helping the patient, behaving honestly and ethically within
Right.
the profession, I think that's a good thing.
Oh, I do too. It is forcing us to bring our profession up, the professionalism of the offices, whether we like it or not. They're pushing us to be more professional, in our offices, even the small offices. But this is just something. It's the way we're going to have to practice in the future, and it's not going away. So just have to bear with it and take advantage of it.
It sounds like it's an excuse to make the practice better and create systems to do it so that you know it's being done, and that way you can forget about it.
Right, right. Very well said. There's a lot of things to consider about when there's ever problems of fraud and abuse. In a small town, my practice is in a little town of 15,000, and if the FBI walked into my office and started asking for files and stuff, I mean, everybody in town would know it probably by lunchtime. I mean, it's a small town. So, any small practice or any small town practice, you're going to have those kind of things happen, and it's just going to kill your practice. So there's a lot of considerations you have to put into play. Make sure you're doing things correct so you don't have to deal with that type of thing and don't have to deal with the cost of a defense. I mean, even if you're completely in the wrong, you still have to get an attorney to protect yourself and show that you're doing everything correct, and that costs money. And the same thing with frivolous lawsuits. That costs you a lot of money. We're going to talk about that in just a second. So, the United States has the highest number of frivolous lawsuits of any civilized country in the world. In fact, the next two behind us are Japan and Great Britain, and if you combine both of those, they don't even come up to a small percentage of what happens here in the United States. The number or the amount of money that goes towards frivolous lawsuits is actually so large, it's like 4 or 5% of our GNP. It's just absolutely ridiculous. And unfortunately, small businesses and startups suffer the most because we end up having to pay a higher percentage to protect ourselves with attorney fees. Big corporations, they may have 8, 10 attorneys working for them. It's no big deal. But for us, if I get sued, I've got to come up with all this money to protect myself, even if I didn't do anything wrong. So, you want to do everything possible that you can do to make sure you don't get tied up in any of these frivolous lawsuits. And having good written policies and procedures is your best defense. So, your policies and procedures are written for your protection. Now, they define and authorize certain things to happen, and they also limit and then delegate so that only certain people can do certain things. With that in place, it gives yourself protection, but also gives your attorney something to work with if you have to, if you do get involved in a frivolous lawsuit. So, that's one of the reasons why we have to write these policies and procedures in such a way that they'll stand up in court. And so all of this is basically a best practice on operating your office. And so it improves the operations, and like I said earlier, it should improve your bottom line. So point number 2, our policies and procedures that we have to have must be written in a concise and formal manner. They have to define the processes, details on the procedures, and of course, one of the main things I always look for is designating the responsibility. So in today's litigious environment, always assume that your policies and procedures will appear in court. I mean, you don't want to write anything in your policy and procedure manual that you wouldn't want shown on a big overhead screen up in a courtroom. Okay, so don't use unprofessional language, don't use slang, don't do anything that you would be embarrassed by if it was put up on a screen in a courtroom. So there are a few specific things to remember. You should always have your clinic name on each page, and each page should have a page number. That protects you so that they come back and say, well, you added that in later. Well, if you can show a copy with, of your previous, with the dates and with the page numbers, that prevents that from happening. Some of the things you need to do is make sure that you have either an adopted or an approved date on each procedure. You can do it on each page, but it's actually better for court if you do it for each procedure. Your scope in our size practices is not quite as important as it would be for a hospital. Like in a hospital, the scope may say these policies and procedures, apply only to the housekeeping staff, not to the secretarial staff. Well, in our offices, in mine, a lot of times it will say it's for the office manager, or the scope may be for the back office CAs, or it may be for the front office CAs. So you can use that scope to basically narrow down who is actually responsible with or for this policy and procedure. You want a title to make it easier to keep a record and to index it. Then your policies. Always policies should be written in a complete sentence format. They shouldn't be long, 1 or 2 sentences. And where you get into detail then is in your procedure. And you want that in a time order so that it walks whoever's reading it through the procedure so they can see this comes first, then you do this, then you do that. And be very careful with your verbs and how you direct things to be done. In a legal document, you must use will or must. Never use can or may. Can or may implies that somebody has an option to do something. When you're doing a policy and procedure, there's no options. This is the way it has to be done, and that's how it protects you in court. So here's an example. The title, policy and procedure format, it was approved by myself. It was adopted on 1/1/2013. That's actually when all these policies and procedures we're talking about today should have gone into effect. The policies, all policies and procedures utilized at my clinic will be in formal format. So the procedure, when a new policy or procedure is developed, it will always be written in, and it goes through then the actual format that we're using. So that's how specific each policy and procedure needs to be. Point number 3. You must make sure all of your employees knows the policies and procedures, and they sign an attestation saying that they've read them, were given the opportunity to discuss it, and that they understand them. One of the big breaches that we had up in the Southeast, and it was a huge fine, was basically because they were fined because they couldn't prove that they had trained their staff. If they could have proved that they had trained their staff in what to do with the breach, it would have probably cut their fine from like $280,000, probably under $100,000. So you've got to have those attestations to show that the staff have read the manual and they know what is in there. And then, of course, when you change it or add to it, you must make sure you get a memo out to everybody. So sorry, but the old-fashioned employee handbooks that we used to use in our offices just aren't sufficient for the new federal mandates. They may be okay for some of the training that we do, but you must have a good, tight policy and procedure manual, not just your employee handbook. Now, your privacy practices. Privacy practices are much, much, much more than a HIPAA manual. Point number 4. There's lots of things that you're going to have policies for we've never had in the past, but now with these privacy policies, things have to be addressed, such as your password. How long does your password have to be? How often do you change it? What happens when an employee quits and walks out with that password? How soon do you have it deactivated? Who's responsible for deactivating it? And then physical security for your office. Who gets keys? Who has the security codes for your alarm system? Things like that. And then, of course, any type of information that is sent out from your office electronically has to be encrypted. We have to have contact methods for the patients that they authorize, not just consent to, but that they authorize us so that we can actually contact them through email or text, things like that. So there's a lot more to those practice privacy policies than the HIPAA manual that we wrote 10 years ago. That HIPAA manual, hit some of the stuff that's still there, but there's so much more now than what we had to do back 10, 14 years ago. Staff training, as I said earlier, we're now mandated to make sure we train our staff, and new staff should, NIST specifically said, the first day a new employee works, they need to be notified and trained on all of the security within your office. So the first thing they should do is have to go through your policy and procedure manual so they know what they can and can't do on the internet. And we've seen that when I've gone in and worked with some of the offices, that what was happening was they did have good training, but it was only done once or twice a year. And if somebody was hired and came on board between those two trainings, they had no training on security until that next main annual training occurred. And that can't happen. There's just too many chances for something wrong, something bad happening, unless you actually get that training done on their first day in. So, document everything, and you must have those signed from the staff saying that they've had their training. We need to have specific training for the doctors so you know what a kickback is, what an inducement is, what all is necessary for medical necessity, what are the standards of care, all of this, and your treatment notes, you've got to have, and you show that you're having training going on for your doctor. Point number 5. All practices must have written policies and procedures concerning abortion. So, it's not something that, you just kind of wait till it happens. You have to have policies and procedures in place that show how to investigate a breach possibility. If something happened, is that a breach? Does somebody actually get access to the information? Who is designated to do that investigation? How should it be written up? Timelines. They want us to have in there, well, if you have a possible breach, how long does that person have to actually investigate that before they make the report back to either the doctor or the compliance manager? That all has to be in writing. And then, of course, you have to be able to set up your corrective action plans if there was a problem. So you need to set up guidelines for reporting as required. That means, and that takes into consideration those whistleblower protections. And, by having your chain of command in writing so that everybody knows and is designated who makes the notifications to who, so that if there is a concern, everybody knows who they need to talk to about it. And then if there is a problem, if there is a breach, you have to have procedures in for notifying the patients who information was exposed. And those have to be in detail. Point number 6, all practices must have written procedures for notification of each level of breach. So the feds have set up 3 different levels for individuals with 10 or under individuals, for under 50 individuals exposed, or over 500. Again, this is something I could spend an hour on just talking about these breaches and how to report it, who to report to, what your letters should look like, how to put it on your website, how to put it into the local newspaper. When do you do all of that? Well, that's a whole nother webinar in itself. But these are the levels that you have to have policies and procedures written and ready to go in your office. If there is a breach and they walk in and they don't find these in place, the fines are just outrageous. So please, please make sure you have these already developed and in play. So looks like we're getting close to time, so I'm going to wrap it all up. Number 1. All practices need written policies and procedures. I know from working in the field, there are a lot of practices out there that still do not have a written policy and procedure manual. Number 2, all the policies and procedures are to be written in a legal format, meaning they've got to have the title, they've got to have the approval date, by who was approved by, etc., like I showed earlier. It has to be in that format to protect you. It has to be that detailed and concise based on what the OIG wants us to do. Everyone in the practice must know and understand the policies and procedures. That's why they have the mandated training. They want to make sure everybody that works for us knows what is expected today. Number 4, All practices must have policies that covers all kinds of security and how to specifically protect that patient information. So these have to cover everything, like I said, from the keys, your security codes, who can go behind your front desk, etc. And you have to have these in writing. Number 5, all practices must have policies and procedures to investigate the possible breach. And then the follow-up with number 6 is these policies and procedures for when to report it, who do you report it to, how do you report it, when that breach occurs. You have to have everything written out so that everybody can walk through step by step with what you have to do. So those are the 6 primary things that we have to do to be compliant in today's environment. And with that, I'm going to ask if there's any questions.
Don, that was that was wild. It's amazing how much information you put into it. My screen is lighting up with questions right now. When you transfer the presenter back to me, I'll show some of them. One question that I've gotten a couple of different ways: how do I find time to implement? How long does it take to get implemented? And we'll be talking about that in just a second. But first, the whole question that comes down to this stuff is you can't do all of it tomorrow. So you have to have some kind of process to implement it. And Carol One Source is sponsoring this. Randy Alexander is here. Randy, are you here today?
I'm on the line.
Okay.
And as always, Dr. Cross, my heart rate goes up. I'm always overwhelmed with the amount of information that you provide.
Stephen, did the presentator switch back to you now?
No, it did not. But I'm thinking that I may need to do it to me. I don't have it.
I gave it
there
up.
it is. Give it to me. I got it. Okay, I'm getting it over here. But it really is amazing. And the question that keeps on coming up, I've got this like 4 different ways, is how to implement, what to do with implementation. And well, Randy, that's you.
Yeah, well, I appreciate you guys allowing me for some time, because I know the folks listening to this, as I am, it's overwhelming. And quite frankly, this package, Dr. Cross and Dr. Weiniger, they have done a great job of putting this package together with so much valuable information. But my perspective is, if I can't implement it, it's of no value. And that's my world. My world is working with chiropractic offices, implementing changes that improve the practice. And this is certainly an area that everyone has to address. Well, they don't have to, as we'll see in a moment, but they need to address, and they need to be able to do it in such a way that they, don't stop treating patients, which is what your world is about. So I just wanted to take a moment and let's go through the options that we have. One is to do nothing, which is a real option, not one that I would recommend, but certainly everyone here's a professional, and it's been proven over and over again that ultimately is very risky and could lead to some real problems for the practice.
Well, Randy, if I can make one point over here, and Randy's someone that's been implementing this. A lot of people you use the OCCM manual by itself, but Randy, I know you've been helping a lot of people do things internally, but I want to make the point that this slide we're looking at right now was created by and sponsored by the federal government, by the Office of Inspector General, and the words on it of deliberate ignorance is no excuse. This is the federal government slide. They are emphatically telling people that ignoring it is not an excuse. No intent to do anything wrong is not an excuse. So that's you're absolutely right. I mean, head in sand is really dangerous.
Yes. You will suffocate.
The fines for that start at $150,000 and go up.
Wow. That's one word. Wow.
So, not recommended. Number 2, the tools are out there. I think a combination of the government. I think there are links. Well, I know there are links on the OCCM website, and one could choose to read, go to classes, take courses, and pull this information together. And that's a real option. I think minimally, Dr. Cross, how many hours, can you even estimate the number of hours you've put in? I mean, it's got to be hundreds and hundreds.
It was definitely in the hundreds. I mean, I spent months putting this together.
Yeah, and so knowing it's there is great. As a consultant and working with chiropractic, the market, I think there are a few chiropractors that are really set up to even start down this path. But it is there. Again, not recommended. And I think what we need to seriously look at is a real option, which is the OCCM program. I personally have assisted a number of practices implement this program. A lot of people ask, exactly what am I getting? Well, first, you're going to get a package that includes all of the critical information that you need to have both physically, that meaning in a binder that someone can grab a hold of and read. It allows you to customize this for your practice, which is really important. It includes the audit logs. In other words, it walks you through how to do the audits, what to look for, when they need to be done. It gives you that outline, along with training logs and 80-some forms. Now, not all the forms you will need to use. Some will be there if something would occur. Others are there that, in fact, you'd want to implement right away. At the end of the day, you're provided with all of the tools to get this program implemented. And what's most important, and I know Dr. Cross brought this up, at the end of the day, you want to implement this and improve the way you're practicing. Make this a positive instead of just trying to fulfill what the government is saying. And this allows you to do that. And so I personally have been involved with it and wish that every chiropractor would take a serious look at this so that, the government doesn't see us as a group that we have our head in the sand.
Now, one thing that I want to put out is what you're about to say next, which is having Randy give you a hand with this. And Randy's an MBA that knows chiropractic practices. And Randy, what's involved with the Chiro One Source personal implementation of OCCM?
So if you have a practice in which you have an individual that can be given a project, and they will march down that path and keep everyone on schedule, in line, so to speak, following up, that's great. Then get the package. If you have a practice where it could be very, very busy, and these types of projects tend to not get implemented or only partially, that's where I can come in and assist you. And all I would really need is a point person that I would work with, and I would hold everyone's hand, so to speak, through the process and ensure that it gets implemented.
And basically, the cost for that is how much?
It's $249. So basically, we have a couple of webinar specials, and so if you just want to get the package, which I highly recommend, that at a minimum you do that, it's $449, and we're going to run that through the end of the week?
Through March 15th, I believe it is.
Okay, all right, the 15th. And then the other special would be to go ahead and get the package, and then my personal assistance in getting implemented, and that's a total of $697. So you get the package and myself for that.
So basically, the website for everything that we're talking about is Obamacare Compliance Manual, which is 4 of the questions that I have in front of me right now, and the other one is there a manual? Yes, there is, and Randy helping is a big part of this. Randy, what else do you want to tell us?
Well, I just want to say that it's critical that you implement it. I have talked to practices that went ahead and bought the package and didn't implement it, and that's they took the first step, spent the money, but we need to implement it. And again, this can be a very positive impact on the practice, and so you want to make sure that it actually becomes a living document that you're using. So if you need to call me, you can call that 866-318-3251. If you have questions about that part of it, I'll be happy to talk to you and help you make a decision on which way you want to go.
Oh, Randy, thank you very, very much. And for those of you that know
Appreciate it.
that know me, I talk about posture. I talk about intelligent practice models, sustainable practice models. And if you're a CPAP, certified posture excellence professional, or you're a chiropractor doing any technique of any kind, staying in business is one of the first rules of business. Doing it in a way that's sustainable. And this is the reason why we've gotten behind helping Dr. Cross, because this is like the most effective thing that I've seen to create a framework that you can implement. And that's the question that I have over here is how long does it take to get implemented? Dr. Cross, any answer to that?
Right. Well, I set it up for a practice like my own. I mean, it's just a small, regular practice, and it usually takes anywhere. If you want to rush it through, you can do it in 3 months, but most practices are taking 6 to 9 months, and that's in line with what the OIG says. They say that when somebody starts doing this type of thing, it usually takes them 8, 9 months to be able to put all this place, so that doesn't overwhelm the staff. It doesn't really make it too hard for anybody. You do it step by step, and you basically just walk through it. And that way, in 6 to 9 months, you've got it all in place.
So basically, all the different things that you're saying that candidly I'm looking at and it's like, oh my God, this is so complicated. When you think about it as one piece at a time, everything's doable. The problem is there's a lot of things to do and there's a lot of things to keep organized. So having a framework for it becomes the key.
Right.
I always
Randy?
Go ahead.
Go ahead.
I was just going to say, I always
training materials
are
there for you, so it can be done by any practice, like Randy was saying. But the training materials are there. There's agendas for your staff meetings. There's handouts for your staff meetings. All of that is built into the program so that it makes it easier for the doctor, rather than the doctor having to try to learn all this stuff himself and then try to train the staff. Well, no, it's all provided for you.
Randy, you were saying?
The part I find interesting is oftentimes a staff member has been handed this project, and then I'm told to give them a call in 5 days. So when I call them, they are like a deer in the headlights, and they are so overwhelmed. They haven't opened up the package yet, and all I tell them is, this is going to be painless. So you walk with me, and we're going to walk through this together, and at the end of the day, it's going to be implemented, but you're not going to be worried about it. It's not going to change how you have to basically deal with your day-to-day activities.
Wow.
So I do it in such a way to ensure that nothing happens to the quality of the care for the patients. Simple.
The thing that keeps on occurring to me is it's kind of like the old saw of how do you eat an elephant? And the answer is one bite at a time. There's an elephant in healthcare and practice to sustainability, to being able to keep on doing what you're doing. Because if you're not doing it and you don't start to show evidence of doing it when they come to knock on your door, and from what I'm hearing, Dr. Cross, sooner or later they will. Is that correct?
That's correct. They've said they're going to hit every chiropractic office in the country. We're an easy mark. They've got us targeted.
And so if when they come in, you're in the process of doing it and they know that it takes time to do it, then you're okay. If you only have good intentions and you said, I didn't mean to do anything wrong, then you're the one that gets to write a check. So doing a process is what I see is necessary. Whether you want to create your own, which is a lot of work, but some people like that kind of stuff, like Dr. Cross, that's fine, but you need to be doing it. If you're not creating your own, the OCCM manual is the most comprehensive thing that I'm aware of in the market, and I've had numerous people at NCLC that are consultants or that work with large groups of practices that have told me the same thing. So that makes me feel good about it. And if you want help implementing it, Randy is great and killer at really holding people's hands and making it, as he put it, a painless process to eat the elephant of compliance. There's a couple of other questions. There are continuing updates and continuing education for staff training with OCCM, and there will be ongoing webinars both for people that have purchased the system and have not going forward. Some things are public, some things you'll need to have OCCM to be able to implement, and there are updates that will be released as is necessary. And Dr. Cross is committed to supporting the OCCM project in creating an affordable, logical, implementable way for DCs to comply and be able to practice effectively in this new era of healthcare. There's a couple more questions. If you could email us, one is yes, this will be audio. This will be a video. You'll be getting a link to a page that has the old webinars. This webinar will be up on that page within the next 24 hours. Randy, thank you very much. Dr. Cross, anything else to say?
Good.
I definitely will be supporting this. I've got a lot of my friends that have bought this, and they're going to make sure that I keep everything up to date.
They know where you live.
That's for sure.
Dr. Cross and I had dinner on Wednesday night with someone that does a lot of support for billing with a lot of practices, and Don, I completely see what you're saying. You have to support this going forward. You have no choice. Guys, thank you very much. A pleasure being here. If you've been attended, thank you very much for sharing your Tuesday afternoon with us. And I hope that we've been able to provide some information to help you become compliant and practice in a way that makes sense and to be a successful practice in healthcare, helping people in your practice to get well and stay well. This is Dr. Stephen Weininger, Body Zone. Kyra Winslow sponsored this today. Guys, thank you very much. Have a great afternoon.